Hey everyone, my name is Meredith Decker, and I am the author for the pediatric knee case. And so I just wanted to go over a little bit about that today, and give you a bit of an overview and tell you actually how I use this case already in our MSAT program. So the idea behind this was to have a real life scenario where a patient tears their ACL and has a meniscus tear, has to have surgery, and there's a bit of uncertainty about what that means for this patient. Now, this is maybe a little bit different of a situation because this family in particular has an awareness that this injury can lead to osteoarthritis based on their family history. And so, in a lot of cases, patients may not really be aware of that, especially in the secondary school setting. But that's the aspect that really needs to be emphasized in the case, that there is a family history that gives them that awareness. And now they don't want that same thing to happen to their own child from a patient's parent standpoint, and then obviously patient standpoint as well. And so the elements of the case, actually, the way I designed it was that anybody that's using it can really kind of pick and choose how they want to use it. And so there's a script just for the patient, which I think is, how a lot of simulation typically goes in most programs where we have an SP acting as a patient. So there's a script for that, but there's also a script for the parent as well. So coming from that aspect of things, which I wanted to add another element to the case from that standpoint so that students can have more of an ability to communicate with parents and get some feedback on that. And so, like I mentioned in the document, you can use the patient case or the parent case, or you can use both if you have the ability to do that. So I designed it that way so every program can kind of utilize something different that meets the needs of the program. So the standards that I'm targeting with this case are 56, so advocacy specifically for the individual, so advocating for the long-term health of the patient with the injury. 58, which is patient education. 59, which is communication in twofold, so with patients and family members, depending on how you use the case. And then 79, the long-term health specifically for osteoarthritis. So that was the target standard all along. So I'll just tell you the way that I use this in our program, I actually used this in our MSAT program last year, is that we only use the parent case. And we had our students, they got some background about the patient, they got the physician note and impression, and then they had the parent email them and try to set up a time to talk. And so the simulation was actually a phone call. And during that phone call, the parent kind of asked some questions, expressed some concerns, and then asked for resources to have a better understanding of osteoarthritis and long-term joint health for the knee. And so after the conversation, the student was then to email the parent those resources and then answer any questions if that came up. And it was a really great encounter, a great experience. And I think that, it's something that we'll implement again in our program. And so, that's one way that we did it. There's obviously multiple ways to do that. And I think this is fine for an early learner. If you want to increase it for an advanced learner, I would suggest adding more behavioral health components into it as well. And then if you needed more, as far as the case goes, I think another aspect would be to add in a physician component. So maybe the AT/student actually talks to the physician about the impressions of the patient. And so, that would add in communication with the healthcare professional in standard 59, and then also adding in standard 61. So those are just some suggestions. But I hope you find that the case can meet the needs of your program in a variety of ways, and hopefully you find that it's useful and impactful for the students. So thank you.